Hello, everyone. We are so glad you could join us. I am very excited about today's topic. Coastal Alabama Community College Nursing recently established a nursing student mentorship program in effort to foster program retention and success. I am Dr. Tiffany Scarborough, the departmental director, and my co-presenter is Dr. Tyler Sturdivant. Dr. Sturdivant is a nursing instructor, and he is also chairperson for our Diversity, Equity, and Inclusion team. Today's discussion includes some background information, the purpose, the processes of the project, what was involved in implementation, some student evaluation information. We'll have some preliminary results for you and discuss some limitations that we've identified along with some future considerations. Coastal Alabama has been very blessed with a flourishing nursing program with really good outcomes in terms of NCLEX pass rates. However, we have identified some opportunities in terms of retention and completion. And when you survey nursing students and really dig into the data related to retention, there are some common themes and some common reports that we often get from students regarding the challenges that they face. Some of those overarching challenges include, just a challenging education. No matter how hard we as educators try to prepare individuals or prospective students, it's difficult to explain the rigor of nursing school. Schedules can be a little hectic. We have long clinical hours. Social life, work-life balance is affected. There are financial concerns. Another concern that we identified was limited diversity. Coastal has tried really hard to address some of these obstacles and provide support, but one area that we saw opportunities for improvement was related to ensuring a sense of belonging amongst students. I'd like to provide some additional background of interest that includes some of our retention rates, and we're really being transparent here. So let's review some of these recent statistics. First of all, our standalone practical nursing program retention rate overall for on-time completion, meaning 3 semesters, was 26% from our cohort that entered summer of 2020 and graduated at the end of spring 2021. For our associate degree nursing program, these are our traditional students, 5 semesters in length. The program on-time completion was 33% for 2020 to 2021. Now, digging a little deeper into course-specific information, we took our 2020 practical nursing cohort NUR 112 course and found a 37% retention rate. For our associate degree nursing fall 2020 NUR 112 course, the retention rate was 65.6%. I'd like to add here that this discussion is a lot about our mentorship program. However, we have incorporated some other initiatives to help us address retention. So not only have we implemented a mentorship program, we've strengthened remediation processes. We've strengthened our relationship and communication with our college counseling services, among other things. So when you do see the changes whenever we review results, please do note that there were some other things that were initiated as well. Coastal Alabama Community College Nursing developed a diversity, equity, and inclusion team several semesters back in order to express the priorities, the values, the commitments of diversity, inclusion, and equity for nursing faculty and students within the programs. So the idea for a mentorship program and for it to be housed in the diversity, equity, and inclusion teams realm came from a situation that I encountered with a student. So this particular student entered our first semester of nursing school as a minority race and a minority gender. This was a phenomenal student. His grades were excellent, wonderful attendance, work ethic, his clinical work was stellar, and so he satisfactorily completed NUR 112, which is our first semester, and the following semester rolled around and the student was not there. So we did as we typically would and reached out and said, hey, are you planning to come back? We noticed your name wasn't on our roster. Haven't seen you this first day of class. And the student's response was that he was not coming back, that he did not have a sense of belonging and didn't feel that he fit in at the school. And this was heartbreaking. So we started looking at what could we do to enhance things like sense of belonging. And it grew from there. What can we do to help with academic success? What can we do to help with retention? The environment of collaboration, what can we do to promote that? What can we do to promote collegiality? How can we encourage these students and have peer-to-peer encouragement? We want that sense of belonging, not only to Coastal, but to the nursing profession. We want to assist with study habits, organizational skills, time management, the work life, school life balance, and all at the same time, we want to embrace diversity and cultural differences.
So, what was our process for implementing a nursing mentorship program for students in our programs to provide that peer-to-peer support? We started in the summer of 2021 with our pilot PN group, so our practical nursing group on the Bay Minette campus. And we started or expanded in the fall 2021 to our ADN or our RN cohort on the Fairhope campus. What I want you to keep in mind is that for both of these pilot programs, participation as a mentor and a mentee were voluntary. So not every student was required to participate. In that PN cohort, we had 26 students who were admitted to the program, but not all 26 actually participated in the mentorship program. And 66 students were admitted to our ADN cohort, but not all 66 participated in the mentorship program. In spring of 2022, we actually implemented the nursing mentorship program across all of our coastal nursing campuses. So Thomasville, Monroeville, Bruton, Atmore, and of course Bay Minette and Fairhope. So all 6 campuses participated in our nursing mentorship program. Prior to the start of the semester, the mentor was educated and provided information on the nursing mentor process and the mentorship program by a faculty designee of the Diversity, Equity, and Inclusion team. And the mentees were educated on the program typically during their actual nursing orientation that's provided before the semester even begins, before they even actually start the program. So we spent 10 to 15 minutes in each course describing the mentor role and the mentee role before that semester started. The process included a NUR 211 and an NUR 221, which is our 4th and 5th semesters in our ADN program. So a senior level student, they were assigned a student in NUR 112 primarily, which is our first semester course, or NUR 113, which is our second semester, our medical surgical 1 and our pediatric courses. NUR 114 and 115, which is our med-surg 2 and obstetrics courses with a leadership component, and 209, which is our mobility course, which allows licensed practical nurses and paramedics to actually enter the RN track. So members of the Diversity, Equity, and Inclusion team actually sent out a survey to potential mentors and potential mentees to complete. And it included basic demographic information, but also included strengths and weaknesses. So our mentors were asked to really describe what they felt they were strong at in regards to nursing school, whether that be study habits, organizational skills, work-life balance. And our lower level students, our potential mentees, were asked to describe what they think they may need the most help with. So was it study habits? Is it organizational skills? And every effort was made with that collective diversity, equity, and inclusion team effort, or that team input, to really pair students with a mentor based on demographics of race and gender, or based on the need and the strength of that mentor and the need of that mentee. The goal in the really the utopia world is to have one senior level student assigned to one lower level student to provide a mentor relationship with. But we all know as faculty, and just statistically speaking, as we progress throughout a nursing curriculum, our senior level students, just in number, is not as much as those that we admit. So sometimes those mentors may have to have one or two or three mentees, and they volunteer to that process. So once the mentor-mentee assignments were made, again with input from the diversity, equity, and inclusion team, uh, the mentor assignment list was actually shared. That document was shared in a drive, and that drive was made accessible to our senior level faculty, so our 211 and 221 faculty, as well as our mentee faculty, primarily our 112 and 113 faculty, really to provide a real-time view of communication. And the requirements of the program required that those mentors made at least 3 contacts to that mentee, and it could be via phone, via email, or even in person. But they had to make at least 3 contacts with their mentee at the beginning of the semester, which is typically the first 4 weeks, at midterm, and toward the end, where we are focusing on final exam preparation. Now, keep in mind that we encouraged and we saw that our mentors made much more contact and communication with their mentees than these 3 required instances, but they were at least required to make these 3 instances at these 3 different times. So as the mentor made communication with their mentee, they would essentially email or provide some kind of documentation to their faculty designee, and that faculty designee updated the shared document in the shared drive, and the senior level faculty and the lower level faculty had a real-time view of what communication was occurring between the mentor and the mentee. So, for example, if the NUR 112 faculty noticed that one of their students were struggling, and they are participating in the mentorship program, they could pull up that document and see if communication has been made between the mentor and the mentee. And if it hasn't, that would be a great encouragement point to encourage communication, to see if that mentor has any study tips, or any other advice that maybe we faculty can't provide to have that student really be successful in the course. Here's a document that we provided to our mentors to really just provide some recommended discussion topics for the first contact, the second contact, and the third contact. And keep in mind, we did encourage much more contact than 3 attempts, but we really wanted to provide a guide for what we saw as faculty as some of the hurdles or some of the challenges that a lot of students, especially those 112 or first semester students, encounter as they start the program and progress throughout the program. So in the first contact, we really wanted the focus to be on orientation. How do we manage our time? How do we manage study time and work and family balance? And how do we balance all of that with our school and the rigor of the nursing curriculum? How are we going to get organized? And how do faculty in the first semester deliver content and deliver schedules and deliver the calendar? We need to be very familiar with our course outline and our syllabus, and get a calendar and keep it updated, as everything for that semester is outlined for you and due dates are outlined for you. Get organized now. Organization is the key. What study tips does that mentor have to offer that mentee on exams or on pharmacology? You know, we have a concept-based curriculum at Coastal. So we incorporate assessment and dosage calculation and pharmacology and disease processes all within one concept and within one process. So students often struggle sometimes with applying pharmacology to those disease processes. What do you have as far as advice for skills validations? Do practice questions help? We also use ATI, or Assessment Technologies Institute, as our NCLEX prep software that we have integrated throughout our curriculum. And they have associated books. Were those books helpful for the mentors? And a lot of times we find that Students, especially entering in 112 in the beginning of that curriculum, they're not aware of the resources that they have. So having that mentor to provide those study tips and what resources were beneficial to them may help them be more successful on a mentee level. We also encourage them to discuss CRE preparation, and CREs at Coastal or critical reasoning exams. And they're basically quizzes that we administer before every skill validation, just to ensure that the student on a didactic level is familiar enough with the skill to actually check off on that skill. Well, how did the mentor study for that, 4 semesters ago? Was it using videos? Was it using the textbook? Or did we complete remediation worksheets to prepare for that CRE? And what did we do to prepare for the skills validation? How did the mentor practice? How did the mentor schedule time in their schedule, in their calendar, to devote to practice time? One of the big things that we see as faculty as well is that students, especially who maybe transfer from other institutions or who are not familiar with Coastal or unfamiliar with our learning management system, which is Canvas, simply navigating the learning management system, understanding where the course outline is, where the due dates are, where the assignments are, and how to submit assignments can be daunting to that first semester student. So providing feedback or encouragement in that area has also been beneficial. How to navigate ATI, how to navigate the PDF record for school reports to submit for assignments if that's what is due, what the different tabs are in ATI, and how to really use those resources to be successful. And of course, the uniform policy. Students in NUR 112 will be in lab for a fairly good amount of time at the beginning of the semester, but will transition to clinical in the later part of the semester. So what's the uniform policy? What do I wear to lab? What do I wear to clinical? What's acceptable? What's not acceptable? For the second contact, we really encourage them to first explain what the midterm process was and what that means at Coastal and how that evaluation process will take place. Again, as NUR 112 students, what to expect with clinical as you approach the end of the semester, what the clinical paperwork looks like, what to expect on a normal clinical day, and how to access and document in ClinPrep. And ClinPrep is just our virtual or our simulated electronic health record where we document all of our clinical paperwork from the day. So having that mentor as a resource to help guide them through, especially that first submission in ClinPrep in any course, has been beneficial. We also encourage our students on second contact to discuss the Merck manual, which is just a virtual library resource that we have at Coastal to essentially search any and all drugs related to any kind of patient diagnosis, and how the mentor can encourage that mentee to use that pharmacology reference in class and clinical. And finally, on the third contact, we encourage final exam preparation, any ATI content mastery series preparation for those specifically assigned assessments in every course, and how to prepare for the next semester. Because we all know that as we progress through a nursing curriculum, typically the expectation and the standard gets a little bit harder. What you need to know gets a little bit harder as you're building on fundamental knowledge as you progress through Med-Surg 1 and Med-Surg 2 and critical care. So not only can we get through this semester, but what does next semester look like? And having that mentor provide that nice transition period, we think would be beneficial. And keep in mind, these are just recommendations on each contact. The mentor can, at their discretion, choose when to discuss what based on the mentee's needs, but we thought it would be beneficial to have this discussion topic page to provide to our mentors to really spark up that conversation and ensure that our mentors were not blindly participating in this process. At Coastal, from NUR 113, which is the second semester and on, we require our students to complete a minimum of 3 service learning hours. We really focus on the true professional role of that nurse, especially as that student graduates and becomes that nurse. And it's not just about didactic and clinical knowledge, it's about being that great professional, that well-rounded nursing professional. So we require 3 service learning hours each semester. And as serving as a mentor, if that mentor documents as described those 3 communications with the designee of the diversity, equity, and inclusion team. If the mentor submits documentation, they will receive 3 service learning hours that fulfills the needs for those learning hours of that semester. What the mentor must provide for each communication, so a minimum of 3 communications to be documented to the faculty designee, was how much time was spent with the mentee during the interaction. And it doesn't have to be a specific time, just a general number. In what format did the communication occur? Did it occur by phone, by email? Was there an in-person meeting? And what was discussed during this interaction? And it doesn't have to be a play-by-play, sentence-by-sentence account of what occurred, because we really wanted to focus on this peer-to-peer support. We as faculty did not want to be deeply involved in the communication process, as we felt that that was part of the problem to begin with. You know, in academia, we really have this traditional hierarchical experience for students from faculty down. But we really wanted to level the playing field and allow students to have that meaningful and educational discussion amongst peers without faculty involvement to the greatest extent. So we just needed a basic overview of what occurred. Did you discuss study habits, organizational skills? But we don't need details on that communication. So if that mentor provided this synopsis 3 times throughout the semester, and the faculty designee typically sends out a check-in email to all the mentors, again, at those 3 points, so the beginning of the semester, the middle of the semester, and the end of the semester, to document this communication. If the mentor provides that 3 documentations, they essentially receive their 3 service learning hours as a reward and as an appreciation for their service in this program. Of course, the faculty designee verifies communication, not only with the mentor, but also the mentee, just to ensure that we close the loop on providing this program and ensuring that, we're all truthful in this process. What we do ask of our mentors, though, is if they do come across any communication with their mentee that is essentially outside of the realm of the student. So if there's any academic advising questions, of financial aid questions, or what courses could I take next, we really want that mentor to contact that faculty designee so we can ensure that the mentee is provided the appropriate information to be successful and to progress in the program. If there's a student safety concern, just based on the communication that's provided, then we want to be abreast of that very, very quickly. Are there any individual performance concerns that the student again feels outside of their realm that they can control, or that they can benefit that mentee? We want to be notified as the faculty so we can help remediate that problem. At the end of the semester, a survey is sent not only to the mentor but the mentee on really some qualitative measures on what did those students like about the mentorship process and what could be changed to improve the process in the future. And do you know anybody that is willing to serve as a mentor, whether that be a student or whether that be a recent graduate? Because we want to build this mentor program not necessarily with nursing, but maybe even across all of allied health in the future. So here are our preliminary results, and these are our first semester program retention rates, and we calculated these rates based on the pilot semester, so that summer semester for our PN group and our fall semester for our ADN group. And to be fair, we wanted to have the best comparison, so we did entire course retention for NUR 112. That's our first semester course, and we felt that this course was the best to really measure, as students typically struggle the most from transitioning from prerequisites to the nursing curriculum. And we compared pre-implementation to post-implementation, and we did entire cohort, even though we know that this pilot was voluntary on a mentor-mentee basis on initiation. We felt to have the best comparison, and really the easiest statistic to compare would be to compare full cohort retention rates of that NUR 112 course. So if you look for the ADN cohort, out of 66 students that were admitted to the program in the fall of 2021, 47 actually progressed to the next semester, so NUR 113. That is a 5.61% increase in retention post-implementation of the mentorship program prior to pre-implementation from the previous year in the same semester in the same course. You notice with our PN group, we had a significant improvement in retention. So of the 26 admitted for that summer cohort, 17 actually progressed to INUR 113, demonstrating an increase of 28.38% in retention as compared to pre-implementation from the prior year and the prior course. So like Dr. Scarborough said, I want to echo that this is not the only process that we've implemented to really focus on retention, but I think in a collaborative effort, the mentorship program is very beneficial in improving at least a sense of collegiality and belonging that has that also potential to increase retention, especially in the first semester. Qualitatively, we've seen that mentors really like the program and they wish that they've had this program in their first semester of nursing school, and they're very grateful for being able to serve as a mentor and especially creating those relationships and those bonds that you may not always develop between a senior level student and a lower level student. From the mentees perspective, mentees have documented that they really enjoyed learning from their mentor, that they've helped with time management, they've helped with study tips, and even if they didn't utilize their mentor early on in the semester, they later realized the benefit of having that communication, having that person to reach out to and to have support of as they progressed throughout the semester and again throughout the curriculum. So what limitations do we have and what are our future considerations? We implemented this in the summer and fall for both our ADN and PN groups as a pilot, and participation was voluntary for both the mentors and the mentees. Well, this may have excluded some participants in the lower level courses because they all didn't participate. And we think it's because, you really don't always know that you may need that mentor's help, that you may need that one-on-one peer guidance as you enter the curriculum. You may think that you only need your faculty's guidance, and not knowing that, even though the education was provided about the program, may have excluded participants from volunteering to participate in that program. We also have to acknowledge that because the participation was voluntary, that the data that we have is not 100% indicative of that entire student cohort, because that entire student cohort did not participate in that mentorship program. So even though we've based our comparison pre and post on that INUR 112 entire course participation rate or retention rate, we understand that that data may not be completely indicative of that entire student cohort. So what are we going to do to hopefully fix this problem? Well, as of spring 2022, participation for the mentorship program is now required for all students who enter INUR 112. So all students who enter the program from the beginning, they are automatically paired with an INUR 211 or fourth semester student. So we have that senior level student who is automatically paired to that incoming student. So education takes place at orientation just as it has before, and education takes place for the 211 just as it has before in that semester prior to implementation. And we still pair mentor and mentees based on demographics and based on potential needs, but now it's required that everybody is at least assigned a person for mentor-mentee relationships. We also would like to host in-person socials or collaborative events each semester sponsored by the Diversity, Equity, and Inclusion team to even further promote that mentor-mentee relationship. They may meet on their own accord outside of class or even in the same building in between class, but we really want to focus on having a coastal sponsored event to further promote that collaboration.
Thank you so much for spending time with us today. It's been a pleasure to present to you. I hope that the information here is beneficial for you in your area and that maybe you'll be able to use some part of this, or maybe it will provide an idea that could be replicated or initiated to impact students positively within your community. So thank you again.